Numb hands can come from a compressed nerve at the wrist or from a nerve root in the neck. Those two problems are treated at completely different levels of the body, and the single most useful detail that separates them is which fingers are involved. The median nerve provides feeling to the thumb, the index finger, the middle finger, and part of the ring finger. It does not supply the little finger, so numbness that includes the little finger is not a median nerve pattern. The median nerve provides feeling to the thumb, the index finger, the middle finger, and part of the ring finger. It does not supply the little finger, so numbness that includes the little finger is not a median nerve pattern. The median nerve runs from the forearm through the wrist into the palm. Carpal tunnel syndrome occurs when that nerve becomes pressed or squeezed at the wrist. The nerve and the tendons that bend your fingers pass through the carpal tunnel together, and the carpal tunnel is a narrow, rigid tube of ligament and bones at the base of the hand. There is very little room in there. The median nerve also controls some of the small muscles at the base of the thumb, which is why this is not only a sensation problem, it is a common nerve condition. Anyone can develop it. It usually occurs in adults, and women are more likely than men to be affected. The timing is distinctive. Symptoms usually start slowly, with numbness or tingling in the fingers, especially the thumb, the index finger, and the middle finger. They often appear first at night, in one or both hands, and then go away during the day. The fingers may feel swollen and cold. People very commonly wake up feeling the need to shake out the hand or the wrist. If you have found yourself doing that at 2 a.m, that is a recognized pattern, not something you imagined. As it progresses, the symptoms stop confining themselves to the night. They start showing up during the day as well, particularly with activities that hold the wrist in one position, talking on the phone, reading a book or a newspaper, or driving. And in chronic or untreated cases, it can become difficult or impossible to grasp small objects. Now, what causes it? I want to be honest here, because this is a place where a lot of confident-sounding advice gets handed out. Researchers do not know the cause. It may result from a combination of factors that increase pressure on the median nerve and the tendons inside the tunnel, rather than a problem with the nerve itself. Irritated tendons can thicken or swell, which narrows the tunnel and compresses the nerve. In many cases, no single cause can be identified. So that is the wrist. Now the neck. Narrowing in the cervical spine can produce neck pain, numbness or tingling that radiates down the arms into the hands, and weakness in a hand, an arm, or the fingers. The symptoms reach the hand, but the problem is nowhere near the wrist. That is the trap. The hand is where you feel it, so the hand is where everyone looks. Two features tend to separate them in the history. Neck origin symptoms often travel shoulder, then upper arm, then forearm, then hand, and they may change with the position of your neck. Carpal tunnel symptoms tend to start in the hand itself, follow the median nerve distribution, and cluster at night. That is useful, but I do not want to oversell it. History and examination narrow the question. They do not always close it. Overlapping presentations are common. Overlapping presentations are common, and a person can have both problems at the same time. That last point matters more than people expect. Overlapping presentations are common, and a person can have both problems at the same time. Because finding one diagnosis does not rule out the other. And it matters, because the two are addressed at completely different levels of the body. If you get the level wrong, you can spend a long time working hard at something that was never going to reach the problem. This is why we test rather than assume. Nerve conduction studies and electromyography measure how the nerves are actually conducting. They can localize the problem to the wrist or to the nerve root instead of inferring it from the story. Nerve conduction studies and electromyography measure how the nerves are actually conducting. They can localize the problem to the wrist or to the nerve root instead of inferring it from the story. Where the neck is implicated, a selective nerve root block can confirm a specific level. Cervical traction and hydrodissection are among the options we discuss once the source is established. Where the neck is implicated, a selective nerve root block can confirm a specific level. Cervical traction and hydrodissection are among the options we discuss once the source is established. If your hand goes numb at night, and you are quietly waiting to see whether it sorts itself out, here is the reason not to wait. In chronic or untreated carpal tunnel syndrome, grasping small objects can become difficult or impossible. That argues for evaluation while the symptoms are still intermittent. And if the little finger is involved, please do not assume this is a wrist problem at all. That is exactly the situation where testing earns its keep.